With an increasing number of people carrying smartphones and tablet computers, the medical community is under pressure to let doctors and nurses access patient data on mobile devices rather than use paper, and let patients wirelessly access their own medical histories as well. At a recent mobile healthcare conference in Toronto, these issues and a number of projects underway right now were discussed.
Well, there's a lot of frustration out there. We have an expectation and a right that we should be well looked after and our family members should be well looked after. Yet we know that there are problems in the healthcare industry. People are not being served in a timely fashion. And a lot of patients are very frustrated, and this frustration extends to within the hospital. The doctors and the nurses, they too are frustrated because they know that they can't provide the help that they want to. And you have to ask yourself why this is going on and whether mobile healthcare can help us.
Dr. Wendy Graham of North Bay, Ontario, told the conference how a patient application she helped oversee is about to go into commercial use.
What it does for patients is it gives them a replica of the patient summary that's a medical EMR or paper EMR in a doctor's office. And we put this in the hands of the patient so that either via the internet or via any mobile phone, whether it's an iPhone or a RIM or a Droid, the patients can access a summary of their information. And by summary, I mean their healthcare demographics, their phone numbers, 4 of them, their allergies, healthcare, chronic diseases, diabetes, allergies, regular medications, over-the-counter medications, and a short list of maybe intermittent medications. And this is very valuable to patients when they're visiting other primary care providers such as chiropractors or a specialist for cancer care. I have transformed from family practitioner to president and CEO of My Health, which will be an operator offering this mobile phone application as a commercial entity to the public very shortly.
Anand Iyer, president of WellDoc Inc., who described his company's application for diabetic patients, later talked about what developers need to think about when creating such applications.
I think it's 4 things. These systems have to first be rooted in clinical evidence, i.e. they have to generate clinical outcomes. So this can't just be an app for an app's sake. It has to be something that has some clinical relevance that the clinical community is going to embrace. Second, it has to be thoughtfully done within the confines of the regulatory environment. We can't go orthogonal to where our regulatory and policymakers want to go. I think there's plenty of room for innovation, even within the constraints we have with organizations such as Health Canada, FDA, etc. I think the third thing is accessibility. They can't think of just one platform. I can't just develop for an iPhone. I can't just develop for Android. How can I tell a patient who doesn't have one of these 2 devices that they can't have access to my solution? So they should be thinking about multiple networks, operating systems, and devices. And I think the last thing is integrability into clinical workflow. To the extent that you can bring the patient and the provider closer together, that's when you start to make a tangible difference in outcomes. That's when you start to make a tangible difference in costs.
One of the themes that emerged from this conference is that there are many roads to mobility in healthcare. An increasing number of Canadian hospitals will make that journey this year. For Network World Canada, I'm Howard Solomon.